transplantation like HCC someday. So to be honest, due to the poor outcomes of cholangiocarcinoma, we surgeons are very hesitating to perform liver transplantation for intrahepatic cholangiocarcinoma. This is a history. A long time ago, so many centers had tried to perform liver transplantation for cholangiocellular carcinoma patients. So this is an example from Dallas. Between 1984 and 1992, they performed liver transplantation for 17 cholangiocarcinoma patients. Out of them, 12 were unresectable cases. 3 were diagnosed from the explanted liver. So they have tried neoadjuvant and adjuvant chemotherapy before and after liver transplantation. So this is their protocol for adjuvant therapy approximately 8 weeks after liver transplantation, including radiation and chemo. So they gave the patient with 5,040 centigrade into porta and regional lymph nodes and started 5 FU continuous infusion for 120 hours at weeks 1 and 4 after liver transplantation. So these are the outcomes. 1 year overall survival was 53%. So 1 year disease-free survival was only 40%. So do you accept this result? So they concluded the patients were able to tolerate the adjuvant chemo and radiotherapy. Unfortunately, this protocol does not appear to provide significant benefit. So until a better adjuvant therapy protocol is developed, it is questionable whether unresectable cholangiocarcinoma should be considered an indication for liver transplantation. So that's why we surgeons still hesitate to do liver transplantation for those who have intrahepatic cholangiocarcinoma. But time changes, so brave surgeons have been trying to overcome these poor outcomes. So this is a relatively recently published paper from China. So they analyzed the SEER data to compare liver resection and liver transplantation. And they compare the outcomes of HCC and CCC. So they analyzed the CR data from the United States. So out of the data, they extracted 2,538 patients with intrahepatic cholangiocarcinoma after curative surgery, including liver resection and liver transplant. Also, they compared the data of 5,048 patients with HCC after liver transplantation. So unlikely in HCC, the intrahepatic cholangiocarcinoma has no definite selection criteria for liver transplantation for now. So however, they categorized the potential selection criteria in this study. So number 1, the very early stage tumor smaller than 2 centimeters with cirrhosis. Number 2, locally advanced tumor, so age stage 1 and 2, plus chemotherapy. So in their study result, the comparing liver resection to transplant, the 5-year overall survival rates of liver transplantation were better than liver resection, so which were 52.8% versus 29.9% in liver resection. So they analyzed the overall survival according to the selection criteria. So in intrahepatic cholangiocarcinoma patients, the Milan criteria did not show different survival rates after liver transplantation. However, the selection criteria 1 or 2 that I mentioned last slide showed significant difference in overall survival. So more interesting result was the criteria 2, which was advanced intrahepatic cholangiocarcinoma with chemotherapy, showed better outcomes than the criteria 1, which was early IHCC group. So however, comparing intrahepatic cholangiocarcinoma to hepatocellular carcinoma, as we anticipated, intrahepatic cholangiocarcinoma showed way worse outcomes than hepatocellular carcinoma. So there are many reports introducing new adjuvant therapy and liver transplant outcomes. So some of them were liver transplant for perihilar cholangiocarcinoma, and the others were for intrahepatic cholangiocarcinoma. The outcomes are varied. So 5-year survival rates varies from 25% to 83%. So this is a prospective study for locally advanced intrahepatic cholangiocarcinoma conducted by MD Anderson team. So they performed liver transplantation for those who had intrahepatic cholangiocarcinoma larger than 2 centimeters, but without extrahepatic disease, vascular invasion, and lymph node spread. So with neoadjuvant chemo, they selected a patient who showed minimal 6 months sustaining response after chemotherapy. So out of 21 patients who underwent neoadjuvant chemo, only 6 patients could get liver transplantation. So after liver transplant, adjuvant chemo, including gemcitabine plus minus capecitabine, was administered for 4 to 6 weeks after liver transplantation. So they reported 83% of 5-year overall survival and 50% of recurrence rate at a median of 7.6 months after liver transplantation. So they showed good survival outcomes, but recurrence is very happen in early after liver transplantation.